Welcome to Compassionate Care Conversations. My name is Scott Bradley. I'm the owner of Bradley & Son Funeral Homes and SimpleCremationNJ.com. I'm a third-generation funeral director, a social worker, and a certified psychoanalyst. My mission here today is to speak with people who can improve the quality of life of the traumatized, the dying, and their stressed-out caregivers. Today, it's my pleasure to introduce you to Laura Huisking, Director of Marketing for Generations Counseling and Care Management. Laura, thank you for meeting me today.
Thank you for having me today.
It is a pleasure. Tell us about yourself and how you came to work in senior care management.
Do you have like 5 hours?
We're
right? We booked this for a long time? All day?
You can talk for 5 hours and we will pare this down to 5 minutes.
Okay, good.
Take as long as you'd like.
All right. So I was actually nowhere near healthcare. I spent the majority of my 20s working for a publishing company, and I was about 10 years there. But the last couple of years that I worked there, my mom got a very rare form of cancer. And since my parents were divorced, it was me and my brother and my sister taking care of a lot of the advocacy, managing doctor's appointments, fighting insurance companies. So it was really that experience that changed my life irrevocably. Like I lived and breathed caregiving. And although I didn't have kids, I was juggling a job. And after she passed away and going through the whole healthcare system, it really made me realize how little caregivers have as a support system. So I really wanted to change my career, and I didn't know how to do that. So I eventually stumbled my way into home care, and I've been with Generations now, which is honestly my favorite job I've ever had. I feel like it's more of a calling at this point. Yeah. So I've been with them for about 6 years now.
Well, good for you for following your heart.
Yeah.
And working where
it was scary. I'm not going to lie. It was very scary making that change. But
sure. I'm curious, when you were taking care of your mom and you were finding all these services you needed, did you use a care manager?
No. Oh my gosh. I didn't know they existed. Yeah. First of all, we were doing everything on our own. We didn't know how to ask the right questions. We didn't know about hospice. And she had a pretty aggressive form of cancer. And I don't think, doctors are very focused on fighting the disease.
Yes.
And which is normal. And I'm not knocking that. It's just, it makes it very hard to plan when you're reacting to everything. So I think it really was, I didn't know. You don't know what you don't know. I think a care manager would have been an invaluable source of support. I was very lucky. I mentioned my crazy Italian family before we started, and they're wonderful and they're filled with support. It just would have been nice to have somebody to run ideas off of, even as simple as that, just a consultant.
Well, we're going to get more into this because my background and my interest is this holistic approach to healthcare.
I love that.
And also this idea, it's an old social worker term, but I really like it. The biology, the psychology, and the sociology of healthcare. Combining all those three together, I think brings up the level of healthcare, the having a better life.
Oh, absolutely. Like we try and focus on how to cure the illness, like fix the illness. And you're forgetting about the joy and the quality of life through that, which is normal, Families are stressed out. They're trying to help their family, and you're doing the immediate need. But we often forget about the mental health aspect of caregiving.
And the extended family and friends. How do we incorporate all of this as a big system of support and healthy living?
What's the first thing when your friend finds out that, one of your loved ones is diagnosed? What's the first question they often ask?
How can I help?
How can I help? Yeah. And we never take advantage of it.
I know. Well, we're going to find out if care management does that. So reading about your journey into healthcare and care management in particular, I'm curious about your take, and we kind of covered it a little bit just a second ago, but your take on how care management influences one's health care.
That's such a great question. I honestly feel like we're the best kept secret in healthcare. People don't know what they don't know. So they don't know what care management is a lot of the time. And I think how we influence healthcare is two-pronged approach. We make the caregiver feel like they're not alone, and helping them navigate a very complicated system that's designed to frustrate them is an invaluable thing. But the other thing we do is help. We make other healthcare professionals. We hold them accountable, and it's very hard as a caregiver to figure out which battles to fight. We're often fighting so many different battles on every front. We're dealing with decision fatigue. We're dealing with complicated emotions. And working at Generations has made me realize that healthcare professionals do make mistakes. So having an advocate, a guide, a trusted partner to help you through things and manage expectations, as well as advocate when someone does make a mistake, that's an unbelievable amount of support.
Yeah. I was just thinking when you were talking, this idea that, like with your mom, you're going through it for the first time.
Yeah.
And the only time, right? Like, so one time you're trying to figure out all these disparate parts, how to put them together to get your mom the healthiest life she can have.
Yeah.
Well, the care manager has been through it 500 times.
Yeah.
And then knows this history of how things can be or should be, and can advocate.
Absolutely. Plus, they see the entire picture. As family members, like I said, you have decades of sometimes complicated family dynamics.
Yeah.
So a lot of the time, your decisions are emotionally infused, and I don't think care managers take the emotion out of it. They just bring objectivity to it.
Yeah.
So they can kind of see far in advance, whereas like you're just reacting to your loved one going through this.
It's a wonderful perspective. I love the idea of objective versus subjective.
Yeah, exactly.
It's not so personal, which makes things so much more challenging to try to figure out. When it can be objectified a little bit with a care manager, then the work becomes easier and probably more efficient and more effective.
Yeah, absolutely.
So how do care managers help manage all these relationships one encounters in healthcare, such as care facilities, assisted living facilities, and doctors, physical therapists, elder law attorneys, and eventually funeral homes?
Well, I know. You've got a lot of balls in the air as a caregiver. And again, we just mentioned caregivers are juggling their own lives, their own families, multiple doctor's appointments, multiple professionals. They're experiencing decision fatigue in a way that it's almost impossible to handle everything at once. Yeah. And we have a healthcare system where there's a lot of moving parts. I mean, in one facility, you could be seeing 4 or 5 different doctors. And even the best doctors have trouble communicating with the entire system. So having one point person that has relationships with all of the moving parts is incredibly helpful. We don't take over any one role. It's more, we're trying to get everybody to work as a cohesive team. And when you work as a cohesive team, you see it every day. Like it makes the caregiving journey much, much easier.
Yeah, I never really thought of it as clearly as right now. Even when someone's in a long-term care facility, it's in their best interest to have a care manager to oversee all these doctors. And even though you might say they're in this whatever 5-star care facilities, that they should be well taken care of. That's not always the case. A care manager oversees above and beyond just that one facility.
No, absolutely. And also you have to think about from the facility's perspective. They've got a lot of different residents there.
Yes.
And every resident, every family feels like their person is the most important. And that's how it should be. Yeah. So there are a lot of times when care managers can point out, the things that we can fix and the things that are normal day-to-day management.
New place for a care manager to work.
I know. Care manager does so many different things.
Yeah.
We cover so many different areas.
Yeah. So with that in mind, like, what does success look like or feel like in your line of work? One, from the care manager's perspective, your employees, and the other from the patient's and family's perspective. What does it look like for success?
I know. So it's a really interesting question because I think we tend to think of success as maybe curing the illness,
Right.
or, and stuff like that. But I think success, this is what I tell my caregivers all the time, celebrate the small successes.
Yeah.
And the small successes could just be a care manager takes just a little bit of stress off of somebody's shoulders.
Yeah.
It's about maybe finding a little bit of joy in some of the tougher transitions. It's maybe finding the right community for someone, or maybe diffusing a complicated situation between family members. Yeah. So success is very different in each case. But I think we tend to think of, all right, we're going to cure the illness. That's success.
Yeah.
And that's not necessarily the way to measure success when you're dealing with aging.
Yeah. As a therapist, as a funeral director, I never think of cure as the end game. I think of emotional satisfaction and living every day to its highest level. And if you cure the illness, great. If not, you live the best life you could possibly live. So that's success, you think?
Yeah, no, I absolutely believe that. Like, one of my favorite things to hear from a client saying, your care manager allowed me to once again be the daughter. And that's what was missing. That gets me very emotional because I had this incident with my mom, and I'll get a little personal here if you don't mind. But I remember I spent so much time being the taskmaster, getting her to eat right, like making sure that the laundry was done, doing a lot of things around the house, and like, all right, now you really got to eat this protein shake. And I remember her looking up at me one day at her house and saying, "Can't you just sit down and watch Harry Potter with me?" I will never forget that moment because I went upstairs and I probably cried about a good half hour.
Yeah.
Because I realized that part of the relationship was slipping away a little.
Yeah. So proud to say I just made an e-guide from my psychoanalytic, social worker, funeral director perspective for like caregivers and care managers and social workers. And a lot of it, I didn't really think of it this way, is about kind of bringing the humanness back to that relationship so people can live their lives and be daughters or sons or spouses and not have to just focus completely on the biology and the doctor's appointments.
I know, and fighting the disease.
And being scared. And so fabulous.
Wow.
That's how you see success.
That's how I see success, yeah.
Wow. Well, I look forward to hearing more about healthcare management. Thank you.
Yeah, you're welcome.